So why do people come to Grillo Center?
There are many reasons that people use our services, and Jared, would you like to say a few words about that?
Yes. Basically, people have numerous reasons for coming. They might have a new diagnosis, so they're wanting to find out more about a diagnosis, or it might be a diagnosis of a friend or family member that they're interested in finding out more about. Sometimes they're looking to access services, find support groups, look for practitioners in the community that might specialize in a condition that they have. They might simply be interested in a particular topic. They've read about it, heard something about it in the news, and might wonder about something that's being researched currently. They also might have wellness questions like, what's the best dose of vitamin B? What's being recommended these days? Things like that aren't really, they don't really have a health issue, but they'd like to find out more about something to stay healthier.
Oh wow, so the Grillo Center does more than work with people who are chronic. It's a resource for all kinds of questions, like even how to wash your hands. Would you be able to find out about that?
We often use the Centers for Disease Control website to find information for people about hygienic practices like washing their hands. When they're traveling to foreign countries, they might want to know what kinds of vaccines they need and things to avoid, things to bring with them. So quite often we'll answer questions like that.
Wonderful.
One of the things that I found to be very empowering is when people come to us after a recent diagnosis, as you mentioned, they're often confused about what that means and even frightened, and we can provide a safe, reliable source of information and support to help them understand what's going on with their health.
So you think empowering is really a major goal, I would guess, of the Grillo Center, of individuals, so that they're comfortable with their understanding of whatever their question is?
Yes.
Yes, and to be active in their own health care and treatment. And there's been studies that have shown that the more a patient participates in their own health through education and being proactive, the better the health outcomes they achieve.
So why should people come and use the Grillo Center?
Well, our research is current and science-based, and it helps people make good decisions about their health and their health care and their treatment. So we make a huge difference in people's lives, empowering them to be well-informed, educated about what's going on with their health, and able to decide on the best course of action, decisions that they need to make about whatever it is that they're struggling with.
So what kind of person do you usually see come and ask questions of the Grillo Center?
It's a variety. It's really all over the board. And Jared, do you want to speak a little bit to that?
Well, yes. I mean, we do have a lot of elderly patrons, but we also have patrons who feel like they really don't have the time or energy to research their questions. A lot of them are in very poor health, and this just takes a lot of energy. Also, people that have used the center before learn quickly that we have access to some things that they don't have access to, and also that we know reliable databases, so we're not having to deal with weeding through all sorts of information that really is not from good sources. So that's probably one of the best things that we can do is, we really limit the amount of information that people are seeing so that they're not as overwhelmed as they might be doing the research themselves.
So you might say that Grillo Center then kind of relieves stress when they need information, or if it's critical, or if they're seeing the doctor, or how do you look at that?
Yes, I think it relieves stress on a couple of levels. One is that they don't have to do the research themselves, so it saves them time and energy. Also because sometimes looking at the information can be very hard. If it's for you or a loved one and there's a lot of negative information, and maybe it's not reliable, but you see that, then it tends to impact your stress level. And then just knowing that you have somebody that you can call and talk to and You know, you can come in and sit with us and do research if you want. There's actually a person there that can help you, and that can really relieve stress because you feel like you have someone who's really on your side.
So are there different ways that a person can use the Grillo Center? I mean, is it online, or do they need to come in? Can they phone? How do you work with people?
There are several different ways. The one-on-one interaction is great. Many people really like that because we provide a safe, confidential space for folks to talk with us about, and our trained volunteers about what's going on with their health and what they're seeking, what information they need. But people can also contact us through our website, grillocenter.org, and can submit a health question that way, and we're happy to respond through email. And other folks call us by telephone, and we're happy to respond as well that way.
So if a person calls on the phone with a question, do you give the information over the phone to them, or can they come in and pick up information? I mean, how do they get the information?
We have basically 3 ways of sending information. One is to send things via email. So we would do the research, put together a packet of information, attachments and links, and email the person. We could print information out, and they could come in and pick up the information, or we could actually mail the information to someone.
So if they're computer literate, you could send like a PDF file, but if they're uncomfortable, then you could actually mail the information.
Yes.
So how do we find volunteers?
There are a number of ways. We have a great resource with the University of Colorado through their pre-professional health program, and quite a few students who are interested in they're studying pre-med volunteer with us. We also have retired health professionals who want to continue to contribute to the community and spend some of their volunteer time working with us, doing research and helping patrons with their health questions. And then we have folks who we've served as patrons. Do you want to say something?
Yes.
About that?
Sometimes a patron will be extremely impressed with how we do things at the center, and once they've gotten their questions answered, they find that they would really like to become one of our volunteers.
So what do you look for in a volunteer, and what kind of knowledge do they need to bring in order to be a volunteer?
Really, we look for compassion and interest in providing service to the community. We're really helping people find good, reliable information, and volunteers who are interested in research and who have a compassionate nature, who are interested in providing that unique resource to the community. We have a brief application form, and I interview each of the prospective candidates. I check references, and then I refer them to Jara.
So there is some kind of filtering process when someone volunteers?
Yes, and our volunteers also go through the BCH volunteer orientation, so they also get screened by Boulder Community Hospital. And then once they've gone through that orientation, we would begin training them at the Grillo Center. And they go through quite an extensive training at the center. We have a list of activities that they must perform before they can start volunteering. So there are things that they need to review and do online. And we also have them follow another volunteer so that they can kind of get a sense of really how the center functions. And then they have training on our subscription databases, which are MD Consult and Natural Standard.
So they're doing research for a question. Is there some kind of filter or making sure that they are actually answering the question correctly? How do you handle that?
Yes, actually all volunteers' research is reviewed by a reviewer. Quite often more than one volunteer will work on research, and then the reviewer will review the final packet and put everything together before it's sent out.
Okay, so is a reviewer a highly technical person, or they have a deep knowledge, or just been in it, doing it for a long time?
Well, it can be a combination of things. Most of our reviewers right now are health professionals that are retired, and basically they have been with the center for quite some time and are in a position to be able to review the questions.
Wonderful.